I didn't even realize that I had been to the ER at Presbyterian for 19 times in less than a year. I would get scared, and my daughter would take me to the emergency room, and sometimes they would keep me overnight, or most of the time they let me go back home. A lot of times when I go with my mother on her appointments, the doctors are in and out. They're in and out, and I guess they got a busy schedule. But a lot of times, things that are wrong with my mother gets misdiagnosed, or it doesn't even get checked. Sometimes they wouldn't know all the medication. If you have 2 or 3 different, they wouldn't know all the different medications you were taking, and they might prescribe something that would interact with the other medicines. A lot of times when we make appointments, it's so far away, and between the time that she needs to see someone, we wind up going to the emergency. It's hard to get some information sometimes when you call, because you have to go to a menu on the phone, and then you have to leave a number. They might call you back, they might not call back, like things like that, which would keep me from going into the emergency room if I could get the information over the phone. We just wind up just going through the same thing over and over and over again. Back and forth to the emergency. And she's not getting well. She's not getting well.
My husband has a lot of doctors, and I don't think that they talk enough to each other concerning his condition. I feel that many times they specialize in that one area that is their area, and the rest, it's like you're a person, but you're broken up into parts, and they only deal with their part.
You go to the wound care guy, he does what he does, and then you go to the orthopedic guy, he goes what he... But they don't talk to each other. While I was in post-op at the hospital, I developed a foot ulcer on my heel because I wasn't maneuvered enough like I should have been.
I think when it comes to communication, it's that famous saying, what we have here is a lack of communication.
I know everybody's human, but it was preventable. And I sit in this wheelchair right now today, the consequence of a preventable mistake.
My husband does get depressed, and with good reason at times, and I try to keep him up, but there are many times when I'm also very depressed and frustrated and think, when is this going to end? Will it ever end?
My wife has been so terrific, and she is really carrying the whole ball of wax right now, 24/7, and it hurts me. It hurts me really badly.
You're responsible for their physical health and their mental health, and somewhere in there you've got to sort of squeeze in responsibility for yourself. Because sometimes if you don't have anything left to give, there's nothing for either one of you.
When we came home from the hospital, I had to be very careful. I didn't know what to do. This was the first time we had been up against something like this, and it was just sinking into my head that he was a heart patient. Wow, a heart patient.
I've had several visits to the hospital because of my heart problem, or my artery problem, I guess you'd say.
Nobody told us anything. And they did say, oh, there will be a person from the hospital coming up to tell you. That all they said to us was, do you have all your things? Do you need another pair of socks? We had our things, and we didn't need socks. We needed information, and the person did not have the time to give it to us.
Between my doctor And my wife, between my doctors and my wife, they all work very hard to keep me going.
I think the caregiver makes up most of the healthcare team because you see the doctor, as my husband sees the doctor once every 6 months. When my husband left the hospital, we were given nothing. I really had to work very hard to find out what he needed to do, what he needed, how he should go through his life. And I felt very, very sad about the people that didn't have somebody that was aggressive to help them. I think the healthcare system must listen to us, not just to hear the 1 or 2 big words that they think will settle the whole thing, but to hear us say what really is in our hearts, and then the healthcare system can do a better job.